She's a New York State Assembly member representing the 87th District in Albany, who happens to also be a registered nurse on the front lines alongside her former colleagues at Montefiore Medical Center Weiller campus in a fight against the deadly coronavirus that has already taken the lives of over 12,000 here in New York City alone.
The severity and of the condition of the patients that we're seeing, of course, is something that's very troublesome.
Assemblymember Karines Reyes, who answered the call by the governor asking that inactive nurses and hospital workers return to their hospital, did just that. She's working 3 shifts at the Weiller branch at Montefiore Medical Center, where she worked in the Department of Oncology.
On a regular shift, under normal circumstances, you would hear maybe one emergency call overhead on the loudspeaker, either a cardiac arrest or a rapid response. And what we were hearing were these emergency calls in the double digits, 10, 15, 20 every shift.
Something she says renews her call for better health care in communities of color.
We have some of the highest rates of pre-existing conditions or underlying comorbidities, but it also shines a light on a lot of the other social determinants of health, like access to housing, access to health care, unemployment or underemployment, lack of access to education, lack of access to healthy foods. All those factors combined spell really negative outcomes for our community, particularly when we are in the middle of a healthcare pandemic.
In the meantime, she'd like the public to heed the guidelines to protect from the spread of the virus.
The governor offered offered an executive order to make sure that everybody wears a mask when they're outside. It doesn't have to be a surgical mask. It could be a bandana. It could be anything that covers your mouth.
The Assembly is currently in recess, allowing her to be with the thousands of heroes now with firsthand knowledge of what we're really up against.
We need to think about how we make sure that every member of our communities is insured and is able to access primary care, regardless of age, regardless of social income, regardless of employment, regardless of immigration status. We should look at healthcare truly as a human right. And that has become increasingly evident in the past couple of weeks.
For BronxNet, Arlene Makoko.